Hello and welcome, everybody. Thank you all so much for tuning in. I'm so excited to dive into one of my favorite topics, fertility. How to heal your body and to conceive naturally is going to be our focus tonight. So, as everybody's jumping on, we're going to jump right in. And to start out tonight, I want to just share with you a little bit about me and why this is such an important topic and such a passion of mine to share. So, I am a doctor of chiropractic. And as chiropractors, we believe that the power that made the body heals the body. And that is so true when it comes to fertility. One of the reasons why I decided to do this webinar is because I hear all the time in the clinic, so many women are told that they're diagnosed with unexplained infertility. And to me, that phrase is simply just means that there's been a lack of investigation and a failure to look further to uncover what's actually causing that couple to have a hard time getting pregnant. I believe that women are designed to carry children and designed for pregnancy and birth. And I love nothing more than helping couples and women to navigate that journey and to feel empowered throughout that entire journey. So, I personally spent years struggling with debilitating periods. I had ovarian cysts that ruptured several times when I was younger, and I was diagnosed with endometriosis. So, because of all of that, I was unsure of what my future fertility really would hold for many years. And that scared me. And that's what led me to really dive deeper to number one, help myself. But then it became such a passion of mine to be able to make sure that other women knew that there was a better way and that other women don't have to struggle the same way that I did for so long. So I took a deep dive into root cause healing to truly understand what was going on in my body and how to actually heal. And what that looked like was comprehensive lab testing. I ran a variety of different tests. We're going to get into that a bit today and talk about some of the tests that are super valuable when it comes to hormone imbalance and fertility. I also looked into my gut health, worked on liver support, worked on reducing inflammation, looked at food allergies, and avoided many different foods that I learned my body was inflamed from and reacting to, and learned to balance my hormones naturally, rebuild any nutrient stores that were deficient. And one of the biggest and most important pieces was really decreasing stress and regulating my nervous system. And as a chiropractor, that is our number one priority, is regulating the nervous system. And what many people don't know is how important chiropractic care is when it comes to fertility. Because if your body is in a state of fight or flight mode, it is not going to be able to focus on helping you to get pregnant. It's going to be so focused and busy just trying to keep you alive. And chiropractic care is incredible for helping to support the stress on your nervous system and to bring somebody out of that fight or flight state. So that was also a really big piece of my journey years ago and continues to be. And of course, I continue to get adjusted and got adjusted all throughout my recent pregnancy. So after healing my body, my husband and I just welcomed our first baby boy in March 2025 after an amazing pregnancy. And we actually had a home birth, and it was everything I could have asked for and more. And going through my own experience is also something that just made me that much more passionate about helping women to know that that option is out there for them and to help those that are really wanting that and wanting to build their family and just don't know where to start. So I'm very excited you're all here, and we've got a lot to go through. So forgive me if I talk fast. I want to make sure we hit on everything. But here's a quick course outline to give you an idea of what's in store. We're going to be diving into some myths to get started and then hit on a bunch of these different topics. And you will get lots of resources throughout this presentation. So if you are hopefully watching this on your computer, you can have your phone ready to scan any QR codes that come up so that you can pull any of the resources that I've included. And no worries, if not, we will email them all out to you afterwards. So you'll be sure to get that. So to start out with some fertility myths, There's so many. I just threw a few on here to get started. But one of the most common ones is that infertility is usually a woman's problem. And this is so important because I've worked with so many women that they make all the lifestyle changes. They do everything I tell them to do to a T, and they're still having a hard time getting pregnant. And a lot of times it's because their husband is just not willing to change some things, or maybe he's not willing to come in and get his own testing done and figure out, where he can improve. So what's really important to know is that 40% of infertility cases are female factor, where maybe it is, a female's immune system or stress levels or some nutrient depletion or something else going on that's impacting the fertility. But 40% of the time it's male factor, and 20% of the time it's actually both that are involved. So when I'm working with women, I make sure to, if we can, get their husband involved as well, to make those dietary changes, make those lifestyle changes, run his own testing, so that it really is, it takes a partner to get pregnant. It takes a partner to prepare for that pregnancy and to have a solid fertility journey together. Another common myth is that you can get pregnant at any point in your cycle. I think that society has done only 6 days out of the monthly cycle. So sperm live for about 5 days, and then the egg is only going to live for about 24 hours after it's released, which gives us that total of 6 days. So it's really the 5 days leading up to ovulation is when you're fertile, as well as the day of ovulation. And it's really important that people realize it's not once you ovulate that you become fertile. I think a lot of people have it a little bit backwards, and that sometimes that's why people are not getting pregnant. It's, their body's in a good spot, but they're just timing it wrong. Another common myth is that birth control does not affect fertility once you stop. I think a lot of women are told you can take birth control whenever you're ready to start having a family. You just stop it, and your period comes back normal and everything's normal and you can just get pregnant. But what I see and work with so many women is that post birth control syndrome. So many women end up with nutrient depletion. They then maybe are not ovulating after birth control, because birth control is actually designed to stop ovulation. So a lot of times that ovulation doesn't kick right back in right away, and we need to give the body appropriate support in order to get your body cycling again and get your body ovulating again. So that's something important to consider if you are somebody on birth control that is hoping to have children in any point in your future. You do have to realize that the birth control doesn't come without side effects. And another myth is that the older a woman gets, the less likely she is to get pregnant. So age is really only a piece to the puzzle. Your overall health is truly so much more important in determining whether or not you will get pregnant. It depends on, are your hormones balanced? Do you have inflammation levels? Are you depleted? Are you eating nutrient dense foods? Do you have the nutrients you need for fertility? So I, can't harp on this enough, that don't let your age ever be a determining factor, despite what your OBGYN might be telling you. As long as we work on your health and get your body in the right state, chances are going to be higher for you. So let's dive into fueling your body for fertility. This is one of the most important things to focus on if you are looking to get pregnant. And there's no better time to start than now, because your body really does take time it's going to take time to make the changes. If you're somebody who maybe never really paid attention to nutrition, then it can certainly take time to decrease inflammation levels in the body and get your body in a state of, balance, so that your body's ready and fueled for fertility. So something that's super common in a lot of women that I see on this journey and struggling to get pregnant is that they are not eating enough. And I see this throughout all phases of life for women. I see it in women that are trying to lose weight. They're not eating enough, and that's why they can't lose weight. And that's another thing that society has kind of taught us as just backwards. But if you're looking to get pregnant, you need to fuel your body for that pregnancy. Don't wait until you're pregnant to start eating a bit more. You need to start doing it now. So skipping breakfast is one of the common ways to actually disrupt your ovulation. And without ovulation, there's no baby, right? We definitely can't get pregnant if we're not ovulating. So, undereating is going to increase stress and increase cortisol. And then this can suppress our thyroid hormones. Thyroid's important for fertility. It's going to lower our LH and FSH signaling, which are pituitary hormones. And then this can lead to a cycle where you're not even ovulating. So, then obviously, pregnancy is not possible. It can lead to short luteal phases. So that's that second half in your cycle. It can lead to irregular cycles and it can lead to low progesterone. And if you don't already know, progesterone is really the main hormone when it comes to pregnancy. That's the hormone that will start to rise and increase a lot once you do get pregnant. And it needs to continue to rise in order to sustain that healthy pregnancy. That is absolutely going to spike cortisol, cause cortisol dysregulation, cause blood sugar dysregulation. And this also is a common way to disrupt our ovulation and impact progesterone levels. And breakfast should really be eaten within 1 hour of waking up. So remember, in order to get pregnant, your body needs to feel safe. If your body is concerned about when your next meal is coming, if your body's in stress, it's not going to feel safe enough to produce another human. So you need to wake up and fuel your body with breakfast. Breakfast is truly the most important meal of the day. Breakfast should not look like a cup of fruit or quick banana as you run out the door, or even something like oatmeal or cereal, because all that does is spike the blood sugar from the start. We don't want to sugar and then a crash, which leads to cortisol dysregulation and blood sugar dysregulation. But instead, we want to start the day high in protein. If you aim for 30 grams of protein in the morning, plus healthy fats and fiber, that is going to be a to help fuel yourself. So I love doing like sausage links and avocado. Super quick, my 30 grams of protein, and I'm getting healthy fats from the avocado. I add a little sea salt, and that's my breakfast. A lot of people feel they need to add in the toast, or they're, revolving their breakfast around the carbs. It's not that you need to avoid carbs completely, but you need to make the primary focus of your breakfast protein. And then focusing on whole foods and nutrient dense meals. So we need a lot of different micronutrients. And if you are somebody who has been on birth control and then your goal is to come off birth control to be able to get pregnant, you are even more deficient in B vitamins because birth control really depletes our B vitamin stores. So Bs are really important: zinc, magnesium, choline, as well as many fat soluble vitamins like vitamin A, D, and K. Iron is crucial, along with so many others. You want to avoid inflammatory foods such as wheat, which gluten is the protein in wheat, sugar, cow's milk, dairy. So what I opt for and tell many patients to do instead of cow's milk dairy, because that can be a lot more inflammatory, unless you're doing A2 milk, that's going to be a better option. Or even raw dairy can be a better option if you don't have a food allergy to cow's milk dairy. But I prefer to do sheep-based dairy. So we do things like manchego cheese, pecorino romano, a sheep's milk yogurt, and that's naturally A2 protein, which is a lot less inflammatory than A1, which tends to be in normal cow's milk product. So that's something to keep in mind, and an easy way to start decreasing inflammation levels. And then you definitely want to avoid your specific food allergies. And this is where it's important to actually test your food allergies each year, know what they are, because they can change with time. And it just gives you more insight as to what your body needs. because I don't believe that every female should be eating the same way. We all have different needs and different bodies that require different nutrients and different foods. So testing your food allergies gives us insight as to what actually causes inflammation and what could actually fuel your body. So, if we're eating inflammatory foods, it can certainly impact implantation. It's going to impact the environment of your uterus, which can lead to more inflammation. It'll impact cervical mucus and ovulation. And then follicle development is going to require a lot of energy. So, think calories equal energy. That's truly what they are. Calories have also gotten a very bad reputation from what, society teaches us, but calories are simply energy. So too little calories means that we're going to be having this cycle of telling your brain that telling your reproductive system that it's not a safe time to reproduce, right? Going back to that fight or flight survival mode. And we don't want to be stuck in that mode because that's when your body's not going to feel like it's prepared and capable of a pregnancy. So, some quick action steps to even take starting tomorrow would be eating breakfast within 60 minutes of waking and hold off on the caffeine. I'm not saying never do caffeine, but you need to do the protein breakfast first. Start with the 30 grams of protein with a healthy fat. Like I said, chicken sausage, eggs is an awesome one. If you're not allergic to eggs, egg allergies are very common, but eggs actually are a really good source of choline, and choline we'll talk a little bit more about soon, but that's really important for pregnancy. And then avoid skipping meals or intentionally cutting calories. Food is our fuel, right? We have to fuel our body for fertility. And then test your food allergies. So if you haven't done that, that's something we do in our clinic. And it's such an easy way to just find out how you should be eating specifically for you. So some superfoods and supplements that are really important. There are truly so many, but I'm highlighting a couple here. Antioxidants are key. And this doesn't go just for females, but for men too. We're going to talk toward the end of this webinar. We'll get into male factor and how important antioxidants are for sperm and the DNA. But definitely make sure that you're including things like berries, citrus, pomegranate, colorful veggies, green tea, even dark chocolate. Those are all really high in antioxidants and super important for both women and men when trying to get pregnant. And then omega-3s. So your omega-3s, yes, you can get from like salmon, wild salmon. You should always do wild caught, sardines, anchovies, grass-fed meats. There's several different foods you'll get them from, but if you are going to supplement, which a lot of times we're not getting enough from the food, and supplementation, you want to make sure that your omega-3 fatty acid supplement is very high in EPA and DHA. If you're ever looking at the back of that supplement and it has a lot of ALA, that has a very, very small conversion to EPA and DHA, which are really the constituents that we want. That's what matters. That's what's going to give us really good properties for actually brain health, but would then help the fetus's brain grow and is going to be super anti-inflammatory. And then folate. This is a common one. Usually this is one people know about, but folate is so important. It's going to support methylation and DNA formation. And it's very, very important. I can't stress this enough to avoid folic acid. No prenatal should have that anymore, but it's unfortunate that prenatals continue to still have folic acid, which is an inactive form and could cause a lot of damage. So we want to avoid that because many people have MTHFR variants, which is a genetic SNP that many women have that can actually impact how your body can convert folic acid into folate. Folate is the active usable form that your body needs. So, and especially for the baby. So that's something to pay attention to. And you want to be doing these supplements prior to being pregnant. Because again, if your body thinks you're in a state of survival or in a state of nutrient depletion, your body is not going to let you just wait till you get pregnant to then, rely on taking a prenatal to start helping the baby. You need to have these high nutrient stores prior to pregnancy in order to get pregnant to begin with. So you can see the recommended doses, they do vary. I always test my patients when somebody is looking to get pregnant. We actually run lab work, and then we know how to specifically support them appropriately with the right amount of nutrients. CoQ10 is a really important one. This actually is important for the energy. So mitochondria are the energy powerhouses of the cell. And CoQ10 you can get from many different foods, as you can see here, but it actually helps with maturing the eggs. So CoQ10 is one of the best things. But choline is essential for neural tube development, methylation, and liver detox of estrogen. So, a lot of us know folate to be that key one, that key nutrient for neural tube development in the baby. But choline actually plays, if not the same, more of a role than folate does. So, that's a really crucial one to make sure that you're getting in. And then what's called ALA, alpha lipoic acid. So, this is a really good antioxidant that can support egg quality. And then vitamin D is key too. Many people think, oh, I'm out in the sun, especially I'm down here in Florida. So we think, it's hot all year. Once we get enough sunshine, my vitamin D should be fine. But I run vitamin D on my patients every day and rarely find that it's fine unless they're supplementing. So start with 5,000 IUs a day if you don't know where you're at. But most of the time, we actually need to supplement with even more than that because people are not really eating much fatty fish and they're not out in the sunshine during the key hours of the day where the sun is the strongest to really get that vitamin D. And then when it comes to prenatals, this really should be individualized. I added here for a resource. One of my favorite prenatal brands is called Needed. This QR code, you can order from them for 25% off on your first order. I think this is a great place to start. It's going to have a lot of all those nutrients we just talked about, and then but it is very important to remember that this won't always cover everything if you're in a depleted state. It's always best to really run your labs, see what else might be needed so that we can tailor that prenatal support to you specifically. And something that I want you to note is you really should be start now, right? It's never too early to start supporting your body, but you should be starting support 3 months before trying to get pregnant when it comes to all these nutrients. Because every egg you ovulate goes through a 90 to 120 day maturation process before it's released. So that means that the quality of your egg at ovulation is going to be directly influenced by what you did in the last 3 to 4 months before you conceived. Right. So that's where sometimes women are, having a month where they're making so many changes, living like the perfect lifestyle, super healthy, and then really frustrated they didn't get pregnant that next month. And it's like, that's not enough time. Your egg is still impacted from what you did 3 months ago. So if we can really give your body a solid 3 months, if you know you're going to start trying to conceive, that's going to just improve your chances, and not only improve your chances of getting pregnant, but actually make your pregnancy healthier and the baby healthier. And the next thing I'm about to say is that it's not just about getting pregnant, right? So that's something I think is so important. It's not just getting that positive pregnancy test. We are working to actually have a healthy pregnancy. How you feel in pregnancy is a direct reflection of your health and your husband's health. So we hear all the time, like I used to get it when I was pregnant, people were like, "Oh, you're so lucky. You never had nausea. You don't feel like crap." And it's not luck. It was all very intentional and years of really hard work keeping myself healthy, and years of hard work that my husband did on his part is why I really was able to have a healthy pregnancy and give birth to a healthy baby. So remember, it's not luck. It truly does take hard work to have a healthy pregnancy and support your body appropriately for a healthy baby. So we talked about folate already, but it is important to know that it helps with early neural tube development, and that closes by day 28 of pregnancy. A lot of times people don't even know they're pregnant by then. So if you wait to start taking folate, once you get that positive pregnancy test, a lot of times it could be a little bit too late to make a big impact. So we want to make sure that those levels are ideal before we even start trying. And preconception nutrition is going to affect the first 8 weeks of pregnancy the most, right? Early on in that first trimester. So we really can't wait to start supporting our bodies. The baby's organs start forming right away. The placenta is developing. And that rapid cell division in the beginning requires tons of nutrients. So we need to make sure we're eating enough. All right, we're going to dive into next on gut health. Gut health plays a massive role in fertility. And I will say this has a massive role in how you feel when you are pregnant. Both your husband's gut health and your gut health will make a big impact on whether you're vomiting all first trimester or not, whether you're nauseous, having tons of food aversions. So this is a really important one to focus on, as well as the immune system. What a lot of people think about when it comes to fertility is hormones only. And you're going to see that I hit on a lot of different topics before I even hit on hormones today. And that's because your immune system matters a lot more. If your immune system is in a hyperactive response, meaning maybe you're somebody with autoimmune tendencies where your body just like reacts to everything, your immune system's freaking out, it's not going to be able to conceive. So let's jump in. Your gut is home to nearly 80% of your immune system and directly impacts inflammation, hormone balance, and fertility. Your gut's going to control inflammation. It's going to control detox and hormone clearance, right? We actually need a really healthy gut to be able to clear estrogen and other hormone metabolites. So if you're somebody like me who had endometriosis, or maybe you just know you have high estrogen levels, that's actually a sign that your gut probably needs work. And that was a big part of my story, is healing my gut in order to heal my hormones. Nutrient absorption. So if you do have poor nutrient absorption, then you're going to end up with poor egg quality. To improve nutrient absorption, we have to work on your gut. And then immune tolerance. So this is what I mentioned just before. If your immune system is overactive, it can actually attack sperm, embryos, and early implantation. It's not going to allow for early implantation to take place. So we need to make sure that we're not in a hyperactive, hyper-responsive state with the immune system. In order to get pregnant, your immune system actually has to decrease. It has to go down and become a bit suppressed. And that's so that it doesn't go and attack the sperm and doesn't attack the growing fetus. So if you're autoimmune and you're dealing with an autoimmune condition, your immune system is already really heightened and might not be able to regulate appropriately to decrease for conception to take place and for pregnancy to take place. A lot of early miscarriages, unfortunately, can also be a result of that immune dysregulation. And a lot of times when we run the lab work on these women or even the men involved, in the pregnancy, then we're seeing that they do have some sort of autoimmune condition going on, and we're finding positive antibodies. A lot of times it's the thyroid, or, it could be so many other things going on in the body. So remember that gut inflammation is going to lead to increased immune activation, which leads to hormone disruption and then lower chances of conception. So a couple quick action steps when it comes to your gut health and how to improve it. Eating fermented foods like sauerkraut, kimchi, pickled veggies, that's going to be really helpful because that will help to increase your beneficial good bacteria, those probiotics. Consuming cruciferous veggies, things like broccoli, Brussels sprouts, cauliflower, those are really good to help support estrogen detox in the body. Especially, again, if you're somebody with endometriosis or maybe suspect you have endometriosis, we need to be able to detox that estrogen and clear it from the system. Eating broccoli more often can actually help with that. And then reduce your seed oils, processed food, sugar, and alcohol. It's not going to do anything good for us. And really running a comprehensive stool test is key. So by running a comprehensive stool test, we can get so much more insight as to what you specifically have going on. We test for things like a yeast overgrowth, bacterial imbalance, lack of probiotics, lack of prebiotics, how well you're breaking down your food, absorbing nutrients. We look at parasites, so many different things. So that's key because I could give you all the general recommendations. That's a great place, again, for the foundation. So you've got your foundational things to start with, but to dive deeper, we always need to do testing. All right, jumping into our fourth section is going to be on inflammation and stress, which I hinted at earlier. Stress is one of the most important pieces to all of this, right? If your body's in a state of fight or flight, state of survival, it will not allow you to get pregnant. So we all know that hormone cortisol. We'll talk about that a bit here. And inflammation, too, is really important. So if you are in a state of chronic inflammation, your body thinks, not safe. We can't get pregnant right now. And inflammation and immune overactivation can lead to things like irregular cycles. So if you're somebody who it's 30 days 1 month, then it's 45 days, then it's 36 days, then it's 22 days for your cycles, you likely are in a state of inflammation and probably some other things going on, hormone imbalance, stress, that could be impacting those cycles. Low progesterone. So low progesterone is a common one, and inflammation is going to shift hormone production away from progesterone. When you're in a state of stress, the same thing happens, and this is where you may see a short luteal phase. A short luteal phase means the second half of your cycle. So if you know when you ovulate and then the time between ovulation and when your next period starts, that's your luteal phase. It should be roughly 14 days. Despite how long your cycle is. Like it should always be right around 14 days. If you're a 10-day luteal phase, that's a sign that you likely have low progesterone. A lot of times spotting too can be a sign, and PMS is a common sign of low progesterone. The moodiness, can't sleep around your cycle, maybe more pain around your cycle, that could potentially be low progesterone. The inflammation and immune overactivation can also lead to decreased implantation. So inflammation is going to affect the uterine lining. We need a positive environment there. And this will make it less receptive and reduce the chance of a healthy embryo attaching. And it will increase your miscarriage risk. Inflammation has a lot to do with that because it's going to increase oxidative stress and immune activation. And then this can impact egg quality, sperm quality, and that early embryo development. So remember that your body is biologically wired to shut down fertility when stress feels high. Your body will always try to keep you alive before it'll try to keep another person alive, right? Before it'll allow you to get pregnant to try to keep a baby alive. It'll always prioritize yourself first. And cortisol, which is that stress hormone, is going to compete with your reproductive hormones, and it'll shift your body into that survival mode instead of that reproductive mode. And that's why stress is so important to manage in order to prepare for optimal fertility. Because if we have high cortisol and just dysregulated cortisol, it can suppress ovulation. It can suppress progesterone, like we mentioned, which again is going to make it difficult to conceive. It'll suppress your thyroid function. And this is actually a key for regulating your menstrual cycle and for fertility. And throughout pregnancy, very important. And then it'll suppress your cervical mucus, and you need that cervical mucus for conception. So that all plays an important part in getting pregnant. Your body can't differentiate emotional stress from physical stress. So I have a lot of women that tell me, well, I love my life. Everything's fine. I'm not really stressed. I don't know why I would be stressed. But it's not just about, having a job that's stressing you out, or a husband that's stressing you out, or a kid stressing you out. It's not about, that emotional concept of stress all the time. Many women are stressed from a physical standpoint. I've seen women that are stressed out because they're overexercising. Some are under eating, and that puts them in a state of stress. Some have just really dysregulated blood sugar. That's creating stress. Poor sleep, inflammation. Like those are all other signs of stress. So don't think that just because you are, living your ideal life, you don't have stress. We all have stress. It's just a matter of what stress is under our control to make a change with, right? Because some of it's not. We don't choose our family. We don't choose, there are some things in the environment we can't just decrease all the stress in our world. But there's a lot that we can control. And that's what's important, to realize what can we control and how can we, get that under control so that that stress is not impacting our body and our fertility. So quick action steps: balancing your blood sugar. This will prevent any unnecessary cortisol spikes. Removing top inflammatory triggers. Again, these are common ones that we've mentioned already. Support your nervous system daily. This is where deep breathing, meditation, outdoor walks, and chiropractic care comes into play. Again, chiropractic care is one of the best things you can do. We are truly nervous system doctors. As chiropractors, we're helping your body to communicate better. We're helping your body to heal better. We're helping your brain communicate with the rest of its body, with the rest of your body, to actually heal and to signal things appropriately. So that is a piece that if you're not already doing, I highly suggest, if you're on your fertility journey, to, start doing that. And then protect your nighttime routine for lower cortisol at night, which helps to raise cortisol in the morning. So to actually have higher cortisol in the morning, which is when we should have higher cortisol first thing in the morning, you need to protect your sleep. You need to protect your cortisol at night. If you're wired at night and you're staying up late and that's when you do your best work, or you're up all night watching movies and then expect to just wake up and have good energy, it's not going to happen. You have to have a very, good bedtime routine and keep lights low, go for a walk. Seeing the sun actually go down can help bring cortisol down at night. And then seeing the sun come up in the morning can help bring cortisol up. And then, of course, get tested to tailor a routine to your body's specific needs, because for everybody, it's different. And that's a lot of what I help women do, is we take a deep dive to figure out, where are your stressors, right? Where are your roadblocks? We know that your body is designed to conceive. Your body is meant for pregnancy. It's meant, to be able to be, it is fertile. We just have to figure out, where are the roadblocks? What's in the way, preventing it from wanting to get pregnant right now. All right, and now the hormones. So as you can see, hormones are not the primary thing. There's so many other factors first that I believe need to be addressed. So I would start there if you were somebody on your journey. Start with the inflammation, the stress, the gut health, and then we can get more into the nitty-gritty of looking at your cycle, looking at your hormones, and figuring out when you're ovulating, your fertile window, and all of that. So this is really important, is that ovulation is the main event, not your period. A lot of people don't realize that. I ask women all the time, do you know when you're ovulating? And very rarely do I get a female that actually understands their cycle and knows when they are ovulating and are in tune enough with their body to know that. So we care a lot about, do you have symptoms around ovulation? Because that could be a sign that something's not quite right. So it's not about the bleed, right? Your body every single month is actually really preparing for a pregnancy, and it's ovulation that is the key event. So if you are not ovulating regularly or not ovulating strongly, you might be struggling with things like PMS, PMDD, the anxiety, the depression leading up to your period that month, painful or heavy periods, acne, hair loss, weight changes, maybe infertility, right? Maybe you've had chemical pregnancies or miscarriages, low libido, mood swings. These are all signs that maybe you're just not ovulating regularly. And what a lot of women don't realize is that you can be getting your period every month and not actually ovulating. Just because you get the bleed, just because you get your period, does not mean you successfully ovulated. And sometimes women ovulate one month and don't ovulate the next. Our ovaries, we have two ovaries, one on each side, and they take turns releasing an egg. So ovulation can change month to month. Is it normal for you to ovulate one month and not the next? No, but it could indicate, there is some sort of imbalance. That's a sign to me that we have to work on something in order to get you ovulating correctly. And a strong ovulation is going to tell us that your body is producing healthy estrogen levels that grow a mature follicle. a surge of LH to trigger ovulation. So LH is that hormone that actually causes ovulation to take place, and that your body has sufficient progesterone afterward to support implantation. So progesterone increases once we ovulate that month during the luteal phase, the second half of the cycle. That's when your body starts to make progesterone, or should start to make it. And that's because it's designed to start getting your body ready for a pregnancy. It's expecting that you're going to have implantation and get pregnant every single month. So that progesterone is really, really key. So, how stress impacts ovulation? Well, it's important to know you can't make progesterone without first ovulating. So, a really good way to determine if you are ovulating would be running your labs after ovulation already should have taken place. So, we often run lab work for women that are cycling between days. It can vary slightly, but usually days like 19 to 21 of their cycle. Day one of your cycle is your period. Maybe you bleed for, say, 5 days, and then you would wait until day 20 ish. And that's because we're looking to test you during your mid luteal phase. Because if ovulation is halfway through the cycle, maybe around day 14, 15, or 16, we want to test about a week later to see and confirm that you did actually ovulate. If you get a progesterone level above 10 on that lab, you can confirm you're a good ovulator. That's a strong ovulation. If you get a progesterone level above 3, we can confirm that you at least did ovulate. While it is, still lower, if it's 3, 4, or 5, we probably want to work on that level of progesterone. It at least tells us that you did successfully ovulate. And if it's very low, maybe below 1, that's usually a sign that you didn't ovulate, as long as we did run that lab work during the right time of your cycle. So progesterone is involved in so many different things. It helps to stabilize your mood. I see a lot of women dealing with anxiety often have low progesterone. If you can't sleep, it plays a part in that too. It's a very calming anti-anxiety type of hormone. It's going to lengthen your luteal phase. Again, that should be around 14 days. So if you have a short luteal phase, you may want to look at testing your progesterone. It's going to help to lower your miscarriage risk. Progesterone is crucial during that first trimester. If you are somebody with low progesterone or somebody that's had prior miscarriages, when I'm working with women, I want to know the second you were pregnant, and we will run labs. And we'll run labs to see where your HCG is, that pregnancy hormone, where your progesterone is. And then we can actually give you herbal support to make sure that progesterone continues to increase so that we can hopefully avoid an early miscarriage and support your body in that first trimester. And then it also helps and is involved in supporting thyroid function and metabolism. If your cortisol is high, the body can actually delay or even shut down ovulation. And that, again, is because it's always going to prioritize survival over reproduction. So women under stress are often going to deal with late ovulation. They may have longer cycles. They can have anovulatory cycles, meaning that you're not ovulating, right? We mentioned that before. And you may have spotting or a short luteal phase. So if that is you, it's important to get those hormones tested. And remember that everything we talked about earlier with stress, inflammation, immune system, and gut health, those can all be different factors that are impacting the ovulation and impacting the hormone imbalance that you may find. So key takeaway when it comes to hormones is healthy ovulation is going to require balanced estrogen, progesterone, insulin, thyroid hormones, and a regulated nervous system. There are millions of women that I know are out there that are trying to get pregnant, yet their physiology is stuck in survival mode. And we can't ignore that. So many women, I think, just go years and years trying to get pregnant, and their body, of course, that's such a stressful, heartbreaking, thing to go through as well. So their body continues to stay stuck in that survival mode. And that's the key. That's the key factor. If we don't address that, it's going to be difficult. So we're going to jump through these 3 fertility signs that I feel are very important to know as females, because these are ways you can start to get more insight, gain more clarity at home without having to run labs or anything like that. You can just get to understand your cycle a bit better. The first one is cervical mucus. This is the most reliable fertility indicator. So as estrogen rises, your cervical mucus should become clear, stretchy, and slippery. And this is what allows sperm to live 3 to 5 days, which is why the mucus is so important. The mucus, or if the mucus is minimal, sticky, or dry, then this could actually tell us that something's off. And remember that this is only going to be around that fertile window because your cervical mucus will change all throughout the cycle. So if it's sticky, dry, or minimal during when your fertile window is, that could tell us low estrogen, maybe dehydration, inflammation, chronic stress, maybe there's nutrient deficiencies, or some sort of gut or microbiome imbalance. The second one, I love this one because I think it's just the easiest. You don't even have to think about it if you are somebody that wears an Oura ring like me, but your basal body temperature, so BBT, this is going to confirm whether or not you ovulated. So you can actually confirm it by understanding your temperature. BBT, which is that temperature, is going to rise after ovulation because progesterone increases your core temperature. So if you detect a clear thermal shift, then you can confirm you ovulated. You'll actually see this on like your app. If you're using Aura or Natural Cycles is one of my other favorite ways to test. I actually pair them together. This is what I used when we started trying to get pregnant. I even used this before that just to track my cycle. You don't even have to be somebody that's actively trying to get pregnant to start doing this. I highly recommend every single female track their cycle this way. It just gives you more insight and clarity into your body. But it's important to know that you can't use this. I do think a lot of women want to use this to figure out when to start trying to get pregnant, right? Like they'll track their temperature, and then once you see that temperature big shift happen, that's telling us you already ovulated. So then it's too late, right? That fertile window is actually before ovulation, leading up to ovulation. So that's just an important thing to know. Here's a QR code where you can scan for natural cycles. Again, like I said, I pair it with Oura Ring, and then I don't have to actively take my temperature. But if you don't have an Oura Ring, Natural Cycles is the best way to do it because then they actually have a new thing now. Instead of the thermometer, it's a band. So that makes it easier, and it'll take your temperature every morning. And then you use the app on your phone, and it actually just gives you that graph. So it's really cool because it tells you when you're fertile, when you're not, if you ovulated, and then you'll just input when your period occurred. So you have like a whole graph. And when I'm working with females on hormone balancing or for fertility, it gives me so much clarity too. I love when they're using at least one of these because then they could bring and show me the graphs, and I can get a better idea of how things are changing and how they're responding to what we're working on together. So that particular QR code there will give you a 15% off membership. So just use that code there that's included. And then cervical position is the third one. So this is a powerful ovulation indicator when paired with the other two. Your cervix is going to change positions all throughout your cycle, and it changes positions based on your hormones. So during your fertile window, your cervix is actually going to be higher, softer, and more open. After ovulation, your cervix will be lower, firmer, and closed. So that can take some practice to get an idea of how to use that as an indicator. But when you use all three, you can really determine, when your fertile window is and when you're not in your fertile window. So LH strips, also known as ovulation strips, or OPK is another one people will say, can be helpful in determining your fertile window, but they don't give us a full picture. So that's really important. LH, again, is that hormone that's going to spike in the body before ovulation takes place. So it predicts a potential ovulation, right? Because it increases before the actual event of ovulation, we can see LH increase and not know if ovulation then followed after. So it's not guaranteeing that you ovulated if you get a positive LH. It just tells us when your body is trying to ovulate. That way you can indicate what day of your cycle do you tend to try to ovulate. So a positive LH is, again, just meaning your brain is attempting to trigger ovulation, and you can have that LH surge without actually releasing an egg. So An anovulatory LH surge might occur if you have PCOS, high stress, thyroid dysfunction, not eating enough food, maybe over exercising. Again, stress on the body, inflammation, coming off birth control. So many different things could be impacting this. And that's where we can figure out what exactly it is for you so we can work on it. If you're using LH strips to determine a fertile window, you have to pair it with other criteria like the basal body temperature, cervical mucus, cervical position, or even blood work. And again, like I mentioned earlier, progesterone above 3 on blood work is going to confirm that ovulation occurred. So, quick action steps when it comes to the hormones. You can start observing your 3 fertility signs at home, right? We have cervical mucus, basal body temperature, and cervical positioning. And then you could start pairing them with LH testing to identify both the fertile window and then confirm if you truly did ovulate. You can also start tracking your cycle at home. My favorite way, apart from doing the basal body temperature, because that's again just getting an idea of did you ovulate, when did you ovulate, but to get more insight and clarity into your true hormones, I love Aneto. Aneto is awesome because it's an at-home device that you can use to actually measure your hormone metabolites. So it'll measure estrogen, FSH, LH, PDG, which is the urine metabolite of progesterone, different from what we measure in blood, but it still gives us really good insight. And this can actually confirm ovulation and tell us your fertile window. So this is also something I used when we started trying to get pregnant. And I knew right away when I was pregnant based on the test results of this, because I could see that progesterone really start to spike and increase. And here is a code where you can actually save, I think it's like $60. It'll save you about 40% off. So this, again, if you don't have a phone where you can scan these QR codes right now, no worries, because you will get an email following this webinar with all the resources that I've included. All right, next we're going to dive into toxins, molds, and egg quality. So I see so many women that are doing all the right things where they're eating clean, exercising, taking prenatals, but it's their environment that's actually quietly working against them and against their hormones, despite all the lifestyle changes they've made. So that's where we need to talk about endocrine disruptors. Endocrine disruptors can be found in so many things. Things like plastic, if you're drinking from plastic water bottles, eating out of plastic food containers, or heating up your food in plastic food containers, fragrance, which is in like almost everything. It's all over the place now. Candles and air fresheners, laundry detergents, cleaning supplies, skincare and makeup, nonstick cookware, and there's so many other ways we can find or areas we can find endocrine disruptors. So these they have the ability to basically mimic or block your natural hormones. So think of endocrine disruptors as chemicals that just like scoot your hormones out of the way and take over. And this can cause your reproductive system to take a really big hit along with your immune system too. And so many other systems in the body will become affected. So the environmental toxins can really disrupt fertility by changing your estrogen levels, right? You can end up with irregular cycles, estrogen dominance, PMS. They can lower progesterone, making it harder to conceive or maintain that pregnancy. It can damage egg quality. So remember, age is what I will say you hear a lot about. That age is the determining factor for your egg quality, but there truly are so many other things that impact it. And I would argue that these other factors impact it a lot more. So things like endocrine disruptors, which impact estrogen, that's going to play a really big impact on your egg quality. Lowering sperm count. So it's not just for the ladies that these can impact, but men too. So it's really important to change out the products you're using in your home. Make sure your man is changing what he's using, his deodorant, his beard oil, and like all the things, because it all adds up and it all makes a really big difference. And it can also disrupt fertility by increasing oxidative stress, disrupting thyroid function. So some action steps. It can be overwhelming to change all your products. By no means do you need to be perfect with this and have every single product in your home being toxin free, but start swapping the ones that you use most often, right? Think about, we put on deodorant every single day. If you haven't swapped your deodorant yet for a clean alternative, one that's aluminum free, and not just aluminum free, but doesn't have all the other crap that most of them have, then start there. If you're somebody, or as a female, we put makeup on. If you're using skincare products and makeup products that are not toxin free, now truly toxin free, because so many companies out there are labeling their products as organic and clean and natural, that doesn't mean anything. So I have put together, we have actually on our website, if you scan this QR code, a bunch of our favorite toxin-free brands, because it can be very difficult to know what to trust. Again, you can't fall for the marketing. It's called greenwashing, where a lot of companies now are just putting pretty pictures of nature on their bottles, or saying it's clean, paraben free, you'll see. That doesn't mean that it's truly toxin free. So it does take a lot of research. I've done all of that research for you on many of these brands. So if you scan this, it does bring you to a page where you can see what we use. These are all products we use. I will only ever recommend things I'm personally using and swear by. But these are products that can make a big difference if you start swapping them. And to avoid the overwhelm, start swapping, again, the things you use the most often, but also as you run out. So as you're coming, down to the last few drops of your shampoo, do the research, look at this site, do some of your your own research, and figure out what you're going to use instead for next time. So let's talk about mold. Mold is something, unfortunately, in Florida, we have so many patients that are impacted by mold because of the humidity, because of the hurricanes, and flooding that can happen. So we see this a lot. It doesn't impact just fertility, but overall health too. So mold will release mycotoxins. Mycotoxins are just those toxins that get released by mold when mold is present. And they're one of the biggest unrecognized contributors to infertility. You don't have to actually see mold for it to be affecting your body. I hear that all the time. Well, no, my house is brand new. I don't see anything. Like, it can't be mold that's impacting me. But it can be hidden in AC units, attics, bathrooms, old water damage, so many different spots. Sometimes it's in people's cars. Sometimes it's at their place of work, right? So it's not always just your home that we need to think about. And how it can impact fertility, it can do that in so many ways. It'll disrupt the thyroid, which causes irregular cycles and will prevent you from ovulating. It can inflame the gut, damage the microbiome. It can damage mitochondria, which, remember, those are what produce the energy. You need that. You need to have high energy in the cell in order to improve egg quality. And then it can increase oxidative stress, again, impacting egg quality and even sperm, and will affect the immune system, which can impact that implantation rate, or the chances of implantation. So mold has a really big impact on the immune system, and can certainly be something that suppresses your immune system, or even leads to an autoimmune type of situation where your immune system is so hyperactive that fertility becomes very difficult. So signs that you should assess for mold would be chronic congestion or sinus issues, maybe headaches that don't have any other explanation, brain fog, fatigue that doesn't seem to improve despite, making lifestyle changes, unexplained inflammation, chemical sensitivities, symptoms that worsen in certain buildings. Sometimes you'll notice, if you travel, you go stay for a week or two somewhere else and you felt great, and then you come back to your home and all your symptoms come back. That can be a clear sign that it might be something environmental in your home, like mold. And sometimes, even getting out of a home that has mold doesn't mean that you're in the clear. The mold will actually, because it forms these mycotoxins, those toxins get stored in your fat tissue. So they're going to stick with you. They're going to stick with you until you actually detox appropriately. So even if you left the home that used to have mold damage, or damage where there was mold, then you still need to do active detoxing, which really you should be led by somebody to go throughout that process, because it can be dangerous and a really tricky journey to detox from mold and make sure that you're gut's in a good spot, your liver's clearing things well, and you're loading your body with antioxidants to appropriately support that detox. So our clinic has put together a mold guide because we work with so many patients that have gone through it. So if you scan this, that'll bring you to where you can download that and get that sent to your email with a lot of different information. We do have some recommendations for local support with mold remediation and how to test your home for mold and things like that in that PDF there. All right. So next we're diving into male factor. So thus far we've talked all about females. I've made hints at, this could impact sperm, and honestly, everything we've talked about already could pretty much all the lifestyle changes your man should be doing too, because it can only help them. But let's talk a little bit more specifically, because as we talked about earlier, 40% of infertility is usually male factor, and 20% of the time it is both. So most couples are only focusing on the women's hormones. And again, so much more of it could be male factor. Even when a woman is doing everything right, conception cannot occur without healthy, well-shaped sperm. That's key. We're actually going to talk a lot more about the specifics of sperm and things that we need to be paying attention to during like a sperm analysis. But the good news is, which this is where it's different for females. Sometimes with females, we're way more complicated, right? As females, like we have so much more going on, and because our hormones change all throughout the month, like our cycles, there's so much more to it. You can help males a lot faster typically to change the state of their sperm health. So sperm dramatically improve in just 3 months with the right steps. They respond a lot quicker to lifestyle change than egg quality will respond in females. So to understand sperm health, we're going to dive into a couple different things that are important to know about. Sperm count or concentration. That means the same thing. So the number of sperm in a sample is basically what we're paying attention to. A low count is going to mean that there's fewer soldiers in the army that are trying to reach the egg. So a low sperm count can be strongly linked to plastics, that's that endocrine disruptor that we talked about, alcohol, heat exposure, nutrient deficiencies, chronic stress, mold, and environmental toxins. So obviously there's a lot of things that can impact it, which is why it's really important to have a well-rounded approach and you can't just make one change. You can't just cut out alcohol and expect you're going to get pregnant the next month. It really does take a well-rounded approach to make sure we're reducing as much stress as possible to improve sperm health. How well they swim is really important. The motility. So healthy motility is going to mean sperm can travel through the cervix, reach the fallopian tube, and then actually penetrate the egg. All of that must take place in order to conceive. So if there's low motility, you might have low motility due to oxidative stress, inflammation, smoking or alcohol, right? Toxicity, poor diet, or again, those endocrine disruptors such as plastics or maybe even fragrance exposure. And then morphology is really important. The morphology of your sperm is going to be the shape and the structure. So healthy sperm are going to need a well-shaped head, intact DNA, and a normal tail. A tail is how they move. So again, without that movement where they go through the cervix and actually can reach the egg, then fertility will be really difficult. So with abnormal morphology, this means that the sperm then cannot penetrate or fertilize the egg easily. And that morphology is going to be impacted again by toxins, by high heat, nutrient deficiencies. These are some common ones that are really important for males. And then the mold and chronic inflammation. And the morphology is also something that plays a major role in embryo quality and early miscarriage risk. I do find many times miscarriages are often linked to sperm health. So if you are somebody that unfortunately has experienced early miscarriages, be sure that they're not just taking a look at, all the female factors and running all the labs on you, but that your, significant other is also running the sperm analysis and a full comprehensive sperm analysis so that we can look at all of these different things. And number 4 is actually, when I say really comprehensive sperm analysis, this is where a lot of times this is not included. So this is one that we do run when we're running a sperm analysis in the clinic. But it's often not ever talked about or ever run by many reproductive specialists. Many, OBGYNs don't really tell you to have your husband go and do this. So the DNA fragmentation means that there's breaks or damage in the sperm's genetic material. If that's occurring, it can lead to genetic issues in the baby, which a lot of times is why early miscarriage happens. So, this high DNA fragmentation can lead to failed fertilization, again, recurrent miscarriage, poor embryo development, lower IVF success, and then higher risk of chromosomal issues. And why may DNA fragmentation occur? There's many causes. It's a lot of what we've already talked about. Heavy metals, could be one. Excessive exercise or sauna use. Think about how many of your men are hitting the gym maybe far too much. Maybe they're just burning themselves out, right? That could be something that impacts their sperm. And that heat. Heat is another one. Cold plunging is actually one of the best things you should have your men do to improve their sperm, as opposed to sauna usage. Sauna usage, the high heat sometimes is not as great for the sperm. So even if you have perfect cycles and healthy ovulation, if the sperm can't swim, they can't penetrate the egg, or if there's DNA damage, then pregnancy becomes a lot harder. So many women put the blame on themselves. They carry that emotional burden, that it's on them as to why they can't get pregnant. And even if there's some things to work on, for the female, a lot of times the males need to work on some things too. So it takes two to tango. It's really important to make sure that you are both getting involved in the fertility preconception process. Sperm regenerates every 90 days. So remember that these improvements really can happen pretty quickly. 3 months in the grand scheme of things is not too long to make massive changes, which can really result in a totally different outlook when it comes to fertility. So a couple more things. We've already hit on a lot of this, but things that impact sperm health. We talked about oxidative stress earlier. This is the number one cause of sperm DNA damage. So this could be changing the diet can make a drastic impact. Changing stress levels, maybe too much exercise. We got to tone it down. And this oxidative stress is directly going to impact sperm count, sperm shape, sperm swimming ability, which is that motility, and the DNA fragmentation. So if there's high oxidative stress, we know that there can be poor embryo development. Another one we already hit on for the females, and this is going to apply to men too, will be the plastics and environmental toxins. So this can decrease testosterone, lower the sperm production, impair motility, and then disrupt the hormones that actually regulate sperm formation. So remember, these daily exposures can add up quickly. Try not to get so overwhelmed with changing every single thing. Like I said, it doesn't have to be perfect, but if you're somebody that drinks from plastic water bottles every day, buy a stainless steel water bottle, and that one swap, add it up over time, is going to make a big difference. Changing your food containers, receipts, cologne, so many different things, laundry detergent. And then nutrient deficiencies. So same as for females, the nutrient deficiencies can be really important. Healthy sperm need to have strong mitochondrial energy, antioxidant protection, and proper DNA building blocks. So these are just some of the common deficiencies that can really reduce sperm count and quality. Things like zinc, selenium, omega-3s, vitamin C, folate, and CoQ10. A lot of them are very similar to what the females need too. So there's a lot of overlap there. And then also molds and mycotoxins, like we already talked about for females. These can impact men far more than they can even impact women. So mycotoxins can reduce the testosterone level, impair sperm production, cause DNA fragmentation, harm mitochondria, which again is the energy, where the energy comes from in the cell, and can increase oxidative stress. So if a couple's living in mold, if there's mold somewhere in the house, doesn't take much many times, then both partners' fertility is impacted. And again, here's that mold guide from earlier in case you need to grab it. And then systemic inflammation. Inflammation will affect the testes' ability to actually make healthy sperm, to protect sperm from DNA damage, regulate hormones like testosterone and LH. So remember that chronic inflammation is what can decrease fertility potential. So here are some quick action steps. Take photos of these and give it to your man. Add a foundational antioxidant stack. So that's where these nutrients that directly support sperm count, motility, and DNA integrity, start adding these in regularly, and your man will see a definite improvement of their sperm quality. And that's vitamin C, NAC. NAC is an antioxidant that is the precursor to glutathione, which helps our liver to detox toxicity from the body. And then zinc and CoQ10. So in our clinic, we do sell high quality supplements. We use mostly liquid herbs and have many of, like Wellness Zinc is one of ours. We have a Q Power, which is the CoQ10. So if you are looking for high quality supplements to get started with, you can scan this and order directly through our site. You don't have to be local. We do ship all over the country. It is so important to make sure that you are not going to Walmart or CVS or Amazon for your supplements. If you're going to take the time and spend the money to take antioxidant support or to take vitamins, to take supplements, make sure that those supplements are high quality. Because the last thing you want to do is add to any toxicity or inflammation by taking poor quality supplements. Another action step would be to reduce alcohol, particularly within the 90 days of trying, right? Because remember, those 90 days are super crucial for the quality of the sperm. And alcohol is going to increase oxidative stress. It'll lower testosterone and reduce sperm concentration. And then you also want to clean up environmental exposures, just like women. So we've talked a lot about that because it can really reduce the sperm production, drive DNA fragmentation. And here you can find my favorite toxin-free products, where there's a bunch of stuff for the whole family. So there's products for men on here, all the go-tos from personal care to house products, things that we use in our home. You can just scan that QR code and find a bunch. And then you want to support diet and blood sugar. Remember, a nutrient-rich diet is what will improve testosterone, reduce inflammation, and support the mitochondrial function. And you want to really focus on getting high protein, healthy fats, colorful produce, lots of colorful veggies, omega-3 rich foods, and then reduce sugar and processed foods. And then, of course, we need to address stress, just like with women. So stress, sleep, and overtraining. A lot of times men, just power through. They think they're fine, but if they're not sleeping enough, that'll lower testosterone. If they have high stress, that cortisol dysregulation will impact them. And then excessive exercise can actually reduce sperm count sometimes. So balancing your training with recovery is really important for the hormones. It's not that they can't, exercise. Men should be exercising. That's an important piece to all of this, but making sure that there's also adequate recovery is key. So we're going to dive quickly into lab testing. There are so many labs out there that can really be used, but I'm going to hit on some of the main ones that I run with my couples that are trying to get pregnant. This first set is a company called ReproSource, and this is where we can run, both for males and females, a ovarian assessment report for the women, and then an advanced semen analysis for the men. And this gives us so much insight. So for the OAR up top there, we're looking at AMH. If you haven't heard of AMH, it's a very common, or not so common, I would say that it's commonly run, but it's a very important hormone to run in the world of fertility. If you've been to reproductive specialists, odds are hopefully they have run this, although I do find that many times it's still not run, and it should be. We should be looking at this more, and it's going to reflect the ovarian reserve. It tells us the current ovarian environment and egg supply potential on this test. And then for the semen analysis, this is where you want to look at the count, motility, morphology, and DNA fragmentation. All four should be measured. So be sure that if you're going to a reproductive specialist, odds are they're probably not testing DNA fragmentation. We find that very often clinics are not looking at that. And like we've said throughout all of this, it's a really important piece to the puzzle because it can impact miscarriage risk. It can impact embryo quality and fertilization success. So there's so many reasons why we use this company, ReproSource. I just talked a lot about it, but we really want to make sure we're diving into both partners, right? Because we need to look at both parties. And sometimes this test can give us insight that was missed in a lot of traditional care. One of my new favorites is the NutriVal test. This is through a company called Genova, is who we use. And this is great because, as we've talked a lot about, nutrient deficiencies are a common reason as to why someone's not getting pregnant, right? It'll create female issues, and for the male, it can lead to issues. So we want to look at these nutrient deficiencies. Methylation is important when it comes to fertility, and this test will dive into a bit of your methylation status, mitochondrial function, amino acids and fatty acids, gut-related nutrient absorption issues, oxidative stress, detox capacity. I mean, so much. This is such a well-rounded test, and it's one of my favorites now for fertility, especially in women, because a lot of times, again, we're just not eating enough or we're not getting enough nutrients, and this can really give us insight into that. And then IgG food allergy testing. So when it comes to food allergies, I'm not talking about, you eat a peanut and have an anaphylactic reaction where your throat swells up. That's one type of food allergy. That's called an IgE food allergy. But what we look at are the IgG mediated food sensitivities. These are different. These are delayed. So it's very hard to pinpoint. You can't quite just food journal it and figure out, what foods you're reacting to. A lot of times people find out that something they're eating every day is actually creating inflammation. So, and it's not that the food is bad to you, right? It's not like, for example, egg happens to be a very common one. It's not that eggs are bad. Eggs are so, high nutrient dense foods, but a lot of people have that immune system dysregulation where your immune system's detecting that egg is bad for you right now. And that's something we need to know about so that we can decrease at that extra stress on the immune system so that inflammation levels come down. And then a GI stool test. This is where we look at gut infections, parasites, yeast, dysbiosis. I talked quite a bit about this earlier. It can lead to endometriosis if you have gut issues. It can lead to PCOS, I've seen. So many different things. It can create inflammation. We need to be detoxing our hormones appropriately, and we depend on our gut health to be able to do that. And then, of course, comprehensive blood work. We want to look at all your hormones and your thyroid. So there's so many things to look at. It's very important that you're testing your thyroid antibodies. That's how we can determine if there's any autoimmune going on. Autoimmune, again, is one of the most common reasons I see that women are not getting pregnant because their immune system is in that heightened state, and it needs to calm down first. So we need to determine what's creating that hyperactivity so that it can calm down and we can help, regulate that immune response so that they can get pregnant. We, of course, want to look at your female hormones, things like estrogen, progesterone, LH, FSH, testosterone, DHT, which is a testosterone metabolite, and then DHEA, which is an adrenal hormone. We want to look at blood sugar, insulin, inflammation, and all your nutrients. And then Dutch testing. This is one of my favorites. If you haven't heard of Dutch testing, it's a really unique way to look at hormones. It's actually a urine test, and it allows us to see your hormone metabolites, which means we get to see how your body's breaking down your hormones. So not only that, but we also look at your adrenals more in depth. Measuring a cortisol level through blood work alone does not give us much insight as to how your adrenal health is. We want to look at cortisol levels through a Dutch test because we can actually see how your cortisol changes all throughout the day. So it's a super cool test, gives us so much insight, and is really important with fertility. So this one's definitely one of my favorites. And then the mycotoxin testing. And again, it's not like every female or every couple needs to run all this testing, but we need to figure out, based on your health history, based on the symptoms you're reporting, what does it seem like could be the roadblock for you? And then that's how we navigate choosing which direction to move forward in to figure out, what's more foundational, what's at that root cause, and figure out where we can start to make improvements in your overall health. So if we suspect mold, this is the test that we then would run. All right. So I know that was a lot of information. I'm going to quickly show you some resources that I've mentioned. And again, these will be emailed to you. So no worries if you can't snag all the QR codes now. But just to give you a little idea too of what natural cycles looks like, if you do end up using it and download the app, you can see this graph here at the bottom. I just think it's so easy to read. They show you exactly where, ovulation is detected, and you can see how hormones are changing throughout the month, which is so cool. And then Aneto takes it a step further. So Aneto is really great if you're trying to conceive, because it's going to show you it's going to alert you and tell you when you're in that fertile window. But you can also confirm ovulation. It gives me so much insight. So I love when my patients are using either one or both of these, because then they can bring me these graphs. I can pick up on a lot of little things. And then that can help me navigate how to support you best and give you other recommendations of things that we need to tweak to be able to fine tune your hormones and your cycle. And then the toxin-free resource guide that I've mentioned quite a bit throughout this, you can scan here. This is where you'll have a link. From here, you can link to our supplement store. That's where you'll find those high-quality supplements. Again, supplements should be individualized. So start with the basics, but if you really want to know what your body needs, you have to run the lab testing to know. We have an Amazon storefront where a lot of my favorites are on there, and then it goes into personal care products, household products, some health and wellness products as well, all toxin-free. And then we make a ton of free PDF health guides just to give you more information and action steps to help your thyroid if you have autoimmune. There's a sleep guide, mold guide. So this link here, this QR code, will take you right to a page on our website with all of our current health guides that you're welcome to download. And lastly, I want you to remember that your body is beautifully designed for fertility. And when we identify what's standing in the way and then we restore the support that your body's been missing, this is when conception and pregnancy becomes possible. And then those miracles happen. So please, if you take anything away from tonight, I hope it's that you should never settle. You should never settle for a diagnosis of unexplained infertility, because unexplained infertility simply means that doctor who gave you that diagnosis failed to look deeper. And there are answers, right? As women, we are designed to be able to carry children. And there are always answers as to why maybe it's not happening, or as to why maybe those miscarriages, unfortunately, you've experienced. So I just urge you to never give up hope that your body can make babies, because that's what we all are put on this earth to do. And that's how God designed the female body. So if you are somebody that has been struggling to get pregnant, or maybe you have yet to struggle, but you just want to take a proactive approach, that's always the best, right? And don't wait until you can't get pregnant for months or years, but let's be proactive. So as a thank you for attending this webinar, I am giving you a special offer to start your care with me for only $99. I work with patients virtually all throughout the United States, or in person in our Sarasota clinic at the Wellness Way Sarasota. So whichever works for you. Even if you're local, I have many women that just want to do it over the phone. That's totally fine. So what is included for $99 to get started, to start your fertility journey? Or maybe you're not even ready to get pregnant or wanting to get pregnant just yet, but want to just get a baseline. To start, we're going to do a comprehensive health history intake. We're going to review previous labs from the last year or so, if you've had any. If you haven't, no worries, because I'll recommend what to run. We're going to do a full review of your hormone, your thyroid, your gut, your stress, toxin-related concerns. We'll talk through so many different things so I can get a really full picture of what may be going on and what those roadblocks might be for you. And then I'm going to give you specific individualized lab testing recommendations. There is no one size fits all when it comes to fertility. It truly takes somebody who's looking at you as an individual and your spouse as an individual to put the pieces together, figure out where those roadblocks may be, and then to help you heal your body so that, again, you can get pregnant, you can have a healthy pregnancy that then leads to a healthy baby. That is my hope for all of you. I think that everybody deserves that. And I think it's a shame that we don't have more information like this out there, because unfortunately, I see so many women that it's years and years that go by of, trying all the things, and they just weren't taught properly. And there's so many things that are truly in our control. There's a lot in our control. And I hope that you learned something tonight. I hope that, if anything, you have a bit more hope for you, for a loved one. And if you are looking to schedule, you can just scan this QR code. This special rate is going to be available for the next 24 hours. So even if there's somebody maybe they didn't catch this webinar, but you can think of a friend, a family member, a loved one who is maybe starting their fertility journey or has been on their fertility journey, I would be honored to walk them through it. You can send them this link as well. And this is our online scheduling platform. So you can choose either a new patient exam with me or an appointment virtually, or that new patient appointment with me in person. So that wraps up tonight's webinar. Again, thank you all so much for joining. And if any of you are ready to take the next step, I would be honored to guide you throughout your fertility journey. Thank you.